Perfect. So, folks, thank you for your time and thanks for the opportunity for me to just talk to you about Rubrik, specifically as we expand into healthcare. And I can talk to you about how we do it, a couple of use cases of customers and hospitals that have used Rubrik and seen the benefits of it, and then I can answer any questions that you may have. Okay. So before I start off in the depths of what we can do, just want to talk to you about how we came about. So 2014, we got on the screen, we got to VMworld, and that's when we announced our presence. We came out of stealth. We basically revolutionized the data protection industry. Before that, it was basically a disparate hodgepodge of technologies that were not really built for cloud, not really built for security. Rubrik out of the gate had a zero trust architecture built on its own immutable platform, which made the backups, immutable, logically air-gapped, and it was cheaper, faster, better was what we kind of came out with. And we exploded with hyper growth. With about 1,000 customers in about a year and a half, and then we could provide customers with various data protection needs and across different workloads that were on-prem. Fast forward a couple of years, as customers started migrating to the cloud, we kind of had a single platform, a single pane of glass, so as to speak, to support their cloud workloads. So if they're running, stuff in AWS or in any other public cloud platforms, or if they wanted to archive to the cloud for long-term DR and residency, we gave them a way to do it. We gave them the ability to do granular restores as well as orchestrated recovery from cloud back to the on-prem. Fast forward a couple of years later, 2017 is when we kind of came across our first ransomware event at a customer site. Rubrik was built for that, right? Rubrik was kind of designed with security and cloud in mind. So we had an immutable backup system with architecture that was recommended by NIST. So we were able to then glean information from the backups. Our backups are protected, right? What happens when you get hit by ransomware, which happens a lot, is the hackers will try to hack into your backup system. Once they have it, then they go after your production. Once they have that too, then you're basically in trouble and you have to pay up the ransom. Because of our file system, because of our architecture, our backups are immutable. So you always had a good, solid copy you could go back on. But along with the data, we could actually glean information from that and can present you an analysis and insights that you would not have before. So with that, we could do things like ransomware monitoring, investigation of ransomware events, figure out what systems were hit, when they were hit, what was impacted, and then we could also run tools within our portfolio that would give you data on, hey, what kind of data was exposed? Was it HIPAA, PII, PCI information? And then we also kind of recently released our threat hunting and monitoring capabilities as well. So we kind of move from a data protection platform to more of a cyber recovery platform, right? And it's kind of now, I can go through some of this, but we have over 5,000 customers that are using Rubrik and it's growing. So what are the challenges that we saw, right, were some of the ones that you see here. Businesses on a daily attack, right? 73% of the data breaches are with healthcare. It's got a target, like a bullseye on its back. Despite all the investments that you folks might have made, in application security, endpoint security, all you need is one person or someone to click on a link, and attackers are still getting it, right? It's not a day goes by before you hear some company being hacked or some healthcare institution or some educational institution being impacted by this. So in the past, when I would go and talk to customers about regarding DR, being in the industry for over 20 years, it was more for like, hey, I have a fire or I have a flood or I have, if I make a mistake while upgrading, that's when I need to use the backup. That's when I need to use the DR, right? But nowadays, it's like happening almost every day. So you need to have shift your thought process of DR is not something that will happen once in a while, but it could happen anytime, given the ransomware targets that healthcare has, right? The bullseye. And what we're seeing is, and you probably have seen some public announcements on that, is it can bring a business down to its knees, right? Hospitals have really gone down. They've had to do everything by hand, and it's not been, it's not a fun event at that point. So how can we help, right? So what we do is we can help with the tools. We can help you answer these questions, right? If the attacker gets in, right? Are our backups protected? So that's your first question you'd ask yourself. Now, if your endpoint protection fails because someone has gotten in, do we know what systems have been impacted, right? Because it's like finding a needle in a haystack if you don't know. And then you have to always assume that data is always exfiltrated. The hackers will get in, they'll scrounge around, they'll get your data out. And once they've successfully exfiltrated your data, that's when they'll start the event. So you need to know what was exposed, right? Whether it was PII, PCI, HIPAA information, or was it just something that was not, it was trivial enough that you don't care about it. Now, once you've done all that, you need to also figure out a clean recovery point so you don't reinfect yourself. And then automate that process, because it's not a single system you're talking about. You're talking about tens, hundreds of systems that could be impacted. And you have to bring it up in a test environment, make sure everything's fine before you roll it out. So we can help you with those, with answering those questions and automating that process for you. So let's talk a little bit about the process here, right? And I'm going to build this out in the interest of time, but an average response to a cyber incident is 21 days. Okay, that's 3 weeks, folks. 3 weeks that you will be down. If you can imagine your hospital system being down for that long, it's unimaginable. And this is exactly what happens, right? When you get hit, your first thing is you have to figure out what a blast radius is. What applications are impacted. All right. Well, what kind of data was it? Was there HIPAA information that I need to be concerned about and let the authorities know? And then the third question is, okay, are my backups secure? Can I recover from them, or do I have to pay the ransom? The longest time that's spent by any organization from what we have seen is to determine that recovery point in time, right? Your InfoSec teams will work with the backup infrastructure teams and recover the data to make sure that it's clean copy. And that, without a tool like Rubrik, can take you days and weeks, because you have to bring up every image, verify it, if not, go back previous days, so on and so forth. The actual recovery is only a small part of it. That process, once you have it, you figure out where you want to go to, that recovery, you can automate it, but it's only after a lot of work that has to be put in by your times. Unfortunately, I've been part of a few ransomware events where our customers have been impacted. All of them were able to recover the data, and they were 100% successful. But that process, for some of the prospects that we had to deal with, took a long time, and that was the middle portion of it took the longest, which was very time consuming and stressful. So how is Rubrik a unique vantage point? And the reason for that is, if you're protecting all the data in your enterprise, like Epic, Cerner, Meditech, virtual machines, on-prem, cloud, we can see all that data. Now, as we're seeing in protecting all that data, we can also get some information about the metadata, and that tells a story, right? That gives you very good insights of what systems have been impacted, which files have changed, when was the change that occurred, where was it that the malware entered, right? So you, within a few clicks, you can easily find out, hey, what systems are impacted, where in the system the impact is, and when did that happen? Because we give you like a time machine view. Now, once we do that, we can also give information on what was in that system, on the systems that will, was it HIPAA, PII information or not. And all this can be done without any infrastructure that you need on-prem. We have the infrastructure that we can do to run all this investigations. And we don't replace your endpoint security. We won't replace your network security, right? We just complement it. So it's one more tool in your last line of defense if, God forbid, you're hit by a ransomware attack. Okay. So why does it matter? We basically will help boards, executives, and even security folks, right, and your superiors to answer questions, critical questions in an event of, in case of an attack, right? What we have seen, some of the positive business outcomes that are resulted from it is because of the tools that we have, customers have been able to reduce the amount of downtime from 21 days to maybe, like 2-3 days, depending on, how big your environment is. That means reduced loss of revenue. And none of our customers who have our products have paid a ransomware payment, right? That's 100% guarantee that we can provide you. And we also have a ransomware warranty that I can talk about. We've also seen that cyber insurance, which has actually gone through the roof last year or two, can be reduced by customers who have Rubrik. or who follow certain practices that the insurers ask you to follow. And we kind of check all the boxes. So if you go back to a customer and say, hey, I've got Rubrik, I've got all these different things in place, we certify it, that reduces your premium, and that's a pretty big amount. Obviously, protecting your brand is of key importance, and just making sure that you're up and operational, and you don't have a negative impact on your business is always a good thing. And finally, we can help you pass your audits, whether it's internal audits, external audits, avoid your regulatory fines, especially around sensitive data. And as you know, sensitive data in a healthcare organization is everywhere, right? And how do you protect it is something that's that should be of your highest importance to you. So I'll just talk a little bit about how it works. So whether you have data sitting on the on-prem data center, whether it's your multiple data centers, whether you made your journey to the cloud, or you're going towards the cloud, and you have infrastructure running in AWS or Azure or GCP, or you have a SaaS platform, email like M365, we can protect all that with a single pane of glass. So it doesn't matter where your data sits. Now, what we do is we give you an immutable air gap copy and backup of that particular workloads. Along with that, we can also give you metadata information along with let's say a time series map. So you can go back to any point in time in your restore process if you wanted to. We kind of package it all into this modern data protection, which is very simple to use, and easy to stand up with little to no management overhead. And we can detect encryption events. So because of the AI and machine learning tool algorithms that we have employed within our product, we can detect if an encryption is happening, what kind of encryption it is, where it's impacted, and then we can also give you information on sensitive data. So we can we give you certain set of policies. You can create your own policies that will allow you to scan your data for any sensitive information, whether it's HIPAA, GDPR, CCPA, you name it. You can create your own custom policies and scan your data for it. So within minutes, we can tell you, hey, look, here's what here's systems that are impacted. Here's what the system impact was in these files. And then here's what kind of data was impacted with it. Now, what we also did, we went one step further. We said, okay, let's take this information and figure out when you were impacted and if you can kind of have a way to prevent reinfection. So we kind of have a way to do threat hunting. So if you give us a YARA rule or file hash, we can kind of scan all your data that you're protected with Rubrik till the beginning of time from the day you started it, and we can tell you when the malware was there in your system. So if you try to reinstall or go back to that point in time, that when you have a clean copy, you're not going to go back to something that's already infected, so you'll get reinfected a few months or weeks down the line. You can quarantine the ones that have been infected, so you don't kind of accidentally reinstall it. We can also provide you some risk assessment tools, so we can come reports that help you with auditors, external, internal audits, and just for your day-to-day operation, which we can make recommendations on what your risk is. If everyone has user access to an open file that has sensitive data, well, that's a risk. So we can provide you with that information. And finally, we can provide you a isolated recovery environment that we can run very quick. We can spin up very quickly. You can install those images in that recovery environment, verify that everything's fine, and automatically roll that into production, right? So all these tools help you, reduce the downtime that you may have, help you, from a DR perspective, help you again from just making sure that you are up and running very quickly. The platform that we offer it on is a SaaS platform. It's called Rubrik Security Cloud. And if you want more information, it's at this rubrik.com/products. And you can kind of find all kinds of white papers, demos, and more information on it.
Hey, Zubin, this was great stuff. As we finish up here, I just want to ask Chris Carrier again from Sanofi, who had questions about how Rubrik can help them in the unfortunate scenario if something is infected. Chris, do you want to ask and make sure your question is answered correctly?
Sure. So yeah, just wondering, if let's say were to happen, how you avoid the impact or having to, having to deal with the ransomware after it's already in your shop.
So if your ransomware is already, if it's infected your systems, it's going to infect your production systems, right? Now, we're not going to be the endpoint that's going to prevent it. But what you can do is, with our tools, you can easily find out, because if you're protecting your entire infrastructure, we can tell you, hey, look, you were infected as of, 2 days back or 3 days back, right? Now, once you do that, you can also find out where exactly in the system the infect is. Using a threat hunting, we can kind of run, the IOCs. You have some IOCs that can be provided to you by a third party, security vendor, or, from, NIST or whatever it is. And we can kind of, or from security teams. And you can run a scan that will tell you that, hey, these are the systems that have been impacted. So don't go and install your data back from these dates on these systems, otherwise you'll reinfect yourself. And we can kind of do that quickly in a isolated environment, so that you can, bring it up, clean it up using Malwarebytes, some other tools that might be provided, and then roll that into production. Right?
Okay, I see. So it's reporting after the fact.
Right. It's not gonna be in real time, because it's not an endpoint detection system, right?
Yep.
But it is your last line of defense. So, it's not gonna, if you have Rubrik and you're doing all the good, you're following all the security best practices and you have the tools, that, I can always go back to that clean copy. I always know that. I don't have to pay the ransom and kind of deal with, the hackers.
Okay. Thank you.
All right. You're welcome. So last couple of slides, folks, just a couple of health systems that have used Rubrik. We have over 300 health systems and growing out of the 5,000 plus customers that we have. There are quite a few large ones in the area local to New England that have moved on to Rubrik. This one, Legacy Health, just kind of picked a couple of those just because it's kind of got a combination of a few things that I want to talk about. Legacy Health was a large health system that had thousands of servers, and they had an old archaic backup system that was just not ready for the cloud, just not able to protect them from ransomware. They moved to Rubrik. What they noticed was, their epic backups, cache backups, were about 2 times faster. Now, Epic has an honor roll, right? And if you kind of can meet and demonstrate that you can meet the requirements of the honor roll, you get breaks, whether it's financial breaks, which are pretty substantial. We can help you with that, right? We have tie-ins with Epic. Epic Hosting uses us, that as a result of which, we can kind of help you back up and restore Epic very quickly, which kind of help them meet the honor roll requirements. And so that helped them in their cost reduction from that perspective. They also noticed that with the policies and the procedures and the tools that they had a 90% plus management time savings. They had 2 or 3 dedicated admins who are constantly working on, having tapes and having to manage all the different infrastructure. And with Rubrik, with our black box approach, we reduced all that down a lot. They had a couple of small DR scenarios, events where they had to restore a handful of virtual machines, and we have capabilities within Rubrik, like Rubrik Live Mount, which brings up your VMs or SQL within seconds, and that help them kind of meet and reduce the downtime, which obviously saved them, revenue loss as well. So that was one of the customers that we're very proud of, and they kind of saw real substantial savings with Rubrik. The other customer that I want to talk about is Rush. It's a 600-bed teaching hospital, but the interesting thing was they kind of had all our tools, and they were migrating to the cloud very quickly as well. But what they did notice was that when the cyber insurance premium came up for renewal, they actually saw a 40% reduction in insurance premium, because they went back to the agency and said, hey, look, we have Rubrik. We are following all these best practices, immutable backups, all the security health checks. And as a result, their premium decreased substantially. They also had a huge, pretty big 365 environment with SharePoint, OneDrive. And as you know, a lot of customers are moving there. And they were able to protect that with the same benefits that we have on-prem, with a single pane of glass, right? So that kind of made their management faster, very easy, simple to use, along with the fact that, their backup and restore times was dramatically improved as well, right? There is stores of certain databases which were taking them 6 or 7 hours were reduced down to like, an hour, which kind of helped them, which kind of helped them a lot. So don't take my word for it, folks. We have over 5,000 customers plus, in different industries. Healthcare is a very important industry for us, and we have about 300 plus healthcare customers, and we are so confident in our ability to protect you that we have a $5 million ransomware recovery warranty that we can kind of give to up to $5 million. If the customer gets all the products, if gets all the features and implements them with our best practices, we can guarantee recovery back to a point in time that they won't have to pay the ransom. And kind of worry about, well, you still have to worry about ransomware, but you don't have to worry about paying or kind of, being down for a long length of time.